Hi, my name is Brittany Engle, and this is my project presentation for NSC 892. The clinical problem I chose to address was smoking cessation education in the emergency department. The purpose of this project was to address the feasibility and manner in which education for cessation could be used in the emergency department effectively. Some background information: tobacco use remains the leading preventable cause of death in the United States, despite its proven link to increasing the risk of cardiovascular disease, respiratory disease, several types of cancers, and numerous other disease processes. Tobacco-related illnesses are commonly seen in the emergency department in patients with asthma attacks or COPD exacerbations. Historically, the emergency room has been reserved for acute disease and injury treatment. However, it does provide advanced practitioners with a chance to educate patients about preventative and restorative care through cessation. Findings from the literature review suggested that it was feasible to present effective smoking cessation education in the ED in a time-efficient manner. The 5A framework utilized in many of the studies provided a standard procedure for identifying and referring patients to the appropriate cessation resources, which is necessary for the development of policies relating to cessation. For my project, I did an educational staff development session that focused on cessation practices in the emergency department. The session included the examination of our current practices and educating the staff on the 5A framework guidelines by the United States Public Health Service, and identifying quality cessation programs in our area for patient referral. A discussion followed the presentation, and questions were encouraged. The cessation aimed to prepare the nurses to use the 5A framework with every smoking patient in the ER. The 5A framework is listed on my poster, and it goes through the triage assessment of whether a patient smokes, and it's completed with the referral to appropriate resources upon discharge from the facility. The intended result is a reduction of smoking patients in the ED and improved patient outcomes. While I was preparing to do this project, I actually found out that we have a smoking cessation class at our hospital that wasn't really being utilized by employees in the ER for referral. So I made sure to tell the emergency room nurses that attended about this. There were about 10 people who came. We had really good discussions about smoking cessation, what we currently were doing about using the 5A framework, and how that would fit into our plan of care with our patients in a timely manner. That seemed to be where most of the nurses were concerned about being able to do this time efficiently. So the medical director actually was in attendance, and she suggested that we maybe make a flyer that had information on our smoking cessation courses. So even if we were really busy and we couldn't provide the education that we wanted to, that patients did have an opportunity to know about the cessation programs. I think that it will need some continued work to make this something that actually happens with every smoking patient. I think that it did open up a lot of discussion about what we could be doing as far as preventative care for our patients. Overall, I think it went really well. Everyone had positive things to say about the educational session. However, if I had more time, of course, I would probably do more sessions. It was in emergency rooms are always unpredictable, and you can't always get the attendance that you would like to have. But in conclusion, I believe that educating smokers in the ED practitioners can help create more positive patient outcomes and contribute to the overall health of the patient. Ideally, these positive outcomes would reduce ED encounters with patients that could be attributed to the lack of smoking. To provide quality education to patients to increase the likelihood of cessation, emergency nurses and staff need to possess the skills necessary to assess for smoking, provide quality education, and to refer to the appropriate cessation resources. Thank you.